So what kind of a training do you give? If it's a health worker, I do understand there'll be certain specifics. Now, when you said a teacher, we are talking about, there are in so many ways, we are teachers to the community. So what would you say is your teaching methods? How do you think that you would be talking to a person who's not a professional? She's not a psychologist. She's not a doctor. So what are the kind of training programs? I know you're going to talk in this, but to just tell in a brief, how do you?
So teachers, it's not necessarily training them in anxiety. With the school teachers, I primarily work on life skills education.
Okay.
And for them to understand, how they could help the child's holistic growth. So I don't tell them how to teach, but I do help them understand how best they can help a child grow with minimum trauma, make it more enjoyable for them to study, make it more enjoyable for them to experience growth. And I have had the privilege of doing a fair amount of work on adolescent health. So adolescence period, as you all know, is a not very easy period because of the physical changes, emotional changes that are happening in a person's life. And how can teachers identify what are the issues, help them as best as they can, and identify at an early stage children, adolescents who require further care, either by a clinical psychologist or a mental health specialist, like a psychiatrist. So that's the kind of work that I do with school children. In all the training programs that I do, I primarily train trainers. Okay. So that is something that I like much more than direct training. Direct training I only do when it's a new training program and I want to test it out. And one of the things I'm very passionate about is experiential training. So anybody who has attended my training programs would know that even if I'm training a group for 10 days, there would not be a single PowerPoint presentations. I like participants to experience certain things in the training program and learn through that and pick up examples from their own real life and use that as a tool for learning. So that way the content, the topics may be same for say 10 batches of training I may do, but the outcome and the details of the discussions in each of the 10 batches is going to be different. Because what are the needs, say, of the doctors working in primary healthcare in Kerala is going to be very different from, say, Jharkhand and Chhattisgarh or Northeast. So the broad structure remains the same, but the content varies quite a bit with each program that I do. So very often that's a challenge also, because a lot of my clients believe that unless you have PowerPoint presentations, the trainers will not be able to replicate the training forward, because everybody is so dependent on using a structured tool. And I like to break that mindset that PowerPoint is the way to go.
Very interesting when people like to put it on a blackboard and show some different kind of scales and graphs. It's very interesting to know how you take the USP of your audience and you work with that and make them find your own answers and work along with them. That's very interesting.
They certainly have to work harder. They have to be better prepared.
Right.
And typically when you have a training with PowerPoint presentation, you have person A who comes for one session, person B for a second session, C for a third session. Yeah. And quite often, suppose it's a 5-day training, participants may have a question related to day one at a later stage, but the facilitator has come and gone. Mm-hmm. Who do they ask the question to? Mm-hmm. But if it is a continuous process where, it's at least one person is steady there. Mm-hmm. If you have a team of 2 people for every session, at least one person is present throughout the program, it becomes easier for participants to go into a flow and clarify their doubts at any point during the training. Okay. So yes, it is interesting. A lot of people, like if I train, say, a group of 30 people in a batch, there would be 4 or 5 who would straight away go and say, no, we can do it. And we don't want to use PowerPoint presentations. Mm-hmm. A few may be a little bit tentative, we will try it out, we'll test it out. Maybe we will keep it as a backup for ourselves, but not use it for the participants. And some of them, maybe about 50% of them, just do not want to try.
Okay.
And I don't blame them. It's not easy to adopt something new, very difficult to come out of their comfort zones. And they all have an image to maintain, because they are either very senior doctors, very senior technocrats, or heads of various organizations like large NGOs. And if they don't deliver very well, they are afraid that the participants would not respect them enough. So PowerPoint becomes a safety net for them. So I don't give them PowerPoints. They can prepare their own PowerPoints and use the methodology if they think that is suitable for them. But even if 1% of the people I train get converted into committed experiential trainers, I think it is worth my time.
Lovely. That's lovely. And to our participants here, I think all of us need to take a pen and a paper. There seems to be a lot of insight that we need to make a note of, as what Savitri is telling us right now. So yeah, I guess it's 4:15 and I think we can start the seminar. We cannot wait any further on.
Okay, so it's a small group, so probably we'll have a more intimate discussion also. To start with, I don't even want to define anxiety right away. I want to ask all of you in the chat box, write 1, if you have experienced anxiety. 2, if you know somebody very intimately who's going through anxiety or has anxiety. And 0, if you either have never experienced or not seen anybody. So on the chat window, can you just write 1, 2, and 3? Okay, I
can see Amrish.
Okay, 1 and 2, 2, okay.
1, 2. Ikshita says 1 and 2.
Yes.
Yeah. Jaya Kamali says 1 and 2.
Okay, so, okay, 2.
Akansha says 2.
Okay, I respect others if they don't want to immediately say. Okay, so I think bulk of you have experienced anxiety. Now, I want you to say 0 if you have never sought help for anxiety, and 1 if you have sought help for anxiety. Sought help for anxiety may be either from a grown-up person, a religious leader, an elderly family member, somebody in your friend circle, or a teacher, anybody. It does not have to be a mental health professional. 0 means you have not sought help for anxiety, and 1 means you've sought help from anybody. It doesn't matter who you have taken help from. Okay.
Yeah.
0, 1, 1, okay.
0, 1. Akansha is 0, yeah.
Okay, so the participants who have responded to this, who have experienced personally or seen somebody else personally, let me start today our dialogue by reassuring all of you that even though anxiety is extremely common, it is something that you can manage well. It is something that you can overcome. It is something that you can say is history to me and yet live a very productive life. You can be anxious and yet be very high performing individuals, but somewhere the joy of living is diminished because of anxiety. So if today at the end of the day you are able to smile and say, each tomorrow for me from now onwards is going to be less and less anxiety and ultimately be anxiety free, I think it will be worth our time today. So what is anxiety? Is anxiety a disease, or is that a mere symptom? Anxiety is not an illness. Anxiety is not something that we would say is a mental illness. Anxiety is just a normal state for a lot of people for short periods of time when there are very stressful situations. You're taking up your 10th exams, your 12th exams, you're going for your first board interview, and you've been working pretty well, but suddenly out of the blue, you get a call from HR, and you begin to worry, why is HR suddenly calling me? Or my boss, why is he suddenly calling me? It is not a scheduled meeting. So that kind of restlessness, anxiety, which is there for a short period of time, is perfectly common. What do you call as anxiety disorder or debilitating anxiety? That is when you have, say, excessive worry, excessive fear, excessive restlessness. You have palpitations, you have sweatings, like you have even physical symptoms. That is not allowing you to lead your normal life, which means your day-to-day activities that you have to do, in some ways, they get adversely affected. So any anxiety, whether for short periods of time or for extended period of time, is not allowing you to function fully. We would call it as an anxiety disorder that needs to be addressed. Anything that is short-lived. For example, suddenly you have taken your exams, but the moment you have the exam paper in front of you, you begin to write your answers, or you are afraid till you go into an interview room, but once you are seated, you are able to take hold of yourselves and give your best. That is not something that we say you should address. But if it is affecting your day-to-day life, I think we need to address it. Anxiety, if it is something that's affecting your day-to-day life, can have two main outcomes. One outcome is you become kind of paralyzed. You have such intense panic that you don't know what to do, literally like you become frozen. And that is called as traumatic anxiety. But there is another outcome likely too, whereby you anticipate something is going to go wrong. You're very afraid of a negative outcome, and then you start preparing for it. Now, that fear may be irrational. The fear may not be something that other people may say is justified, but you are afraid of it and you start preparing for it. For example, you have to speak on a public platform and you are not very sure if you're going to do a good job. PowerPoint is one tool that you would use. You may make your notes, you will carry a small piece of paper. You may have somebody sitting right in front of you whose face is more relaxing for you. So you would take certain steps that is going to help you deal with an anxious situation, basically preventive measures. And that is known as signal anxiety. Now, signal anxiety is good because it helps you prepare. But if anxiety itself is debilitating your normal day-to-day activity, then even then it's not good, because you're investing too much time in preventing an attack or an episode of anxiety, which takes time away from other things you could have done at that point of time. Okay, so another question people already think is anxiety is fear. Anxiety is linked to fear. They're very often associated with each other, but they're not the same. Fear is usually a response or a reaction to real danger. You know, it's like you want to cross a road and you think there is no vehicle coming, and suddenly you see a vehicle come at great speed and you are scared. So that's a real danger, right? Usually fear is short-lived. Anxiety can be associated with fear, but it is the result of psychological and physiological changes that happen in the body because of a stressful situation or anticipation of a stressful situation. The response to danger that comes in anxiety is from within. It's like an inner voice. It's like you think there is something telling me, like an intuition. There is inside you a voice or inside you a warning that is coming. And that is what is anxiety. It lasts much, much longer. Fear is short-lived. Usually your stressful situation is over. your stimulus is over and fear is gone. But in anxiety, it doesn't go very often. Now, many people I come across, when they recognize anxiety and fear are not exactly synonymous, they begin to try to rationalize and say, well, is it fear? Is it anxiety? If it is fear, I don't have to worry too much. And my advice, if any one of you in this group is also thinking similarly, do not try to label it. Very often, anxiety linked with fear, you will not be able to even identify the root cause of it. You may not be able to see from where it is coming or why it is coming. Why am I feeling like this? It may be difficult for you to identify that. Do not label it. Acknowledge that there is a symptom that is not allowing you to be comfortable and it is affecting your day-to-day life and you need to address it. What causes anxiety? Very often anxiety is because of your own surroundings, the family environment in which you have grown, the community in which you have grown, the society in which you have grown, the experiences that you have at school, the experiences that you have amongst your peers as school children. Everything from the time you are born affects your anxiety levels in your adult life. The more you suppress your emotions or the more you suppress your memories as at a younger age, the greater is the probability that it will surface as anxiety at some point or time in future. So childhood experiences very often is the root cause of anxiety later in life, whether it is young adulthood or even in your old age. Another cause is suppressed emotions, anger, frustrations. If you have suppressed them for a very long period of time, that alone becomes anxiety. Now, anger management is a different topic altogether. And I would only like to say here, if you do not want that suppressed emotion to lead to anxiety in future, learn to express your anger in a way that doesn't harm you and doesn't harm another person. So there are multiple ways that you can learn to manage your anger and see that it doesn't become a cause of anxiety at a later stage. It's very easy for people to say, don't get angry. Now, if it is your nature to get angry, you will get angry. But express it in a way that doesn't harm you or somebody else. Sometimes suppression of anger can also harm you. And one of the ways it harms you is through anxiety. The third cause is physical causes. Physical causes like, say, pregnancy, adolescence, after a major illness. Now, there are a lot of hormonal changes happening in pregnancy and adolescence. Mood swings are quite common in these physiological states. After you have recovered from a major illness, just because of the emotional and physical difficulties and trauma you have gone through, anxiety is very common. Usually, once this stage, physical state has passed, anxiety can subside on its own. In some cases, it can remain for a long period of time. The least important cause of anxiety is hereditary. Some people say, oh, anxiety runs in our family. My grandmother was always anxious. My father was always anxious, or my mother was always anxious. Hereditary is the least important cause. Yes, there are certain behavioral disorders that are common through family, but it is not necessarily genetic. It maybe has something to do with the upbringing itself and the way the parents take care of the children. That probably can have a cause much more than the actual genes that is causing. Now, there are different types of anxiety. Anxiety is not like one entity. So we have something called anxiety states, and we have something called phobic disorders. Now, these are not related to any mental illness, but they are different manifestations of anxiety. So when we say anxiety states, there are three conditions that I'd like to discuss today. One is panic disorder, which in some ways, I'm sure all of us have experienced in life, because panic is a common reaction to a lot of real life situations too. Another is generalized anxiety disorder. And the third is obsessive compulsive disorder. So of these three, obsessive compulsive disorder definitely needs medication, and I'm going to touch upon it much less other than just the signs and symptoms. But panic disorder and generalized anxiety disorder, which are more common amongst people, is something that I would discuss in greater detail. So what are panic disorders? As the name suggests, there are recurrent panics. There are recurrent episodes of not knowing what to do, intense anxiety. It can either begin very slowly. That means, over a period of time, it builds up because you have not been able to address it. Or it can just suddenly come out of the blue and you don't even know what is it that has caused it. To diagnose as panic disorder, it's important to rule out that you don't have any other mental illness. And it is also without precipitating factors. That means, it's not like you went through a major accident and after that you have a panic, or it is not because you lost somebody very dear to you and then you have a panic. So there should be no precipitating factor. And usually, how do you know it's a panic? The symptoms are something that are very commonly known. You feel panic. That means you are afraid, you are restless, you don't know how to act, you cannot think logically. Some people have palpitation, some people have chest pain. And in adults, there is always a fear. Any chest pain, can we label it as heart attack? But panic attack chest pain is usually short-lived. It is not linked to any physical activity. It usually disappears after a period of time, and there is no known cause for it. Some people have very difficulty in breathing, or they can have rapid breathing. So any kind of breathing disturbance associated with the fear or a panic. People may feel dizzy. I cannot stand. I'm feeling I have to sit down immediately. Sometimes there is this deep feeling of an impending doom. You don't know what's going to go wrong, but you constantly feel something is going to go wrong. So these are general broad symptoms of panic attack. All of us have it, but can it be diagnosed as panic disorder? The answer is no. There is very specific diagnostic criteria. Now, for defining or for labeling your panic as a panic disorder, there have to be certain conditions that are met with. One is at least 3 episodes in 3 weeks. So it's not that last 3 weeks episode have happened and immediately people are going to go in for help. It could have happened at any point of time, but there have been at least 3 episodes in 3 weeks where you may have more than 4 symptoms, range of symptoms. Like I just mentioned, it could be palpitations, it could be breathing difficulty, it could be sweating, it could be a choking sensation, chest pain, tinglings in your hands and feet. You may feel hot and cold flashes alternately. You may have your body might be shaking. You may have a desire to do something, like you cannot sit still. You may have a desire to do something, and where you feel, I think I'll do something that makes me crazy, or something that you would not have under normal circumstances done. So if you have at least 4 of these symptoms and you've had 3 episodes in 3 weeks, that is the first criteria. The second criteria is if it is a past event, then at least for a month after one of the 3 episodes, you should have had fear of a similar episode coming in. You constantly think, what if the same episode comes again? What if I I feel panic like that again? What would I do? Then you may be afraid of the consequences of panic. That means, would I do something that I would normally not do? Would I act in a manner that is going to be either detrimental to me or others would think is quote unquote crazy? So the fear of your actions as a result of that also persists for more than a month. Then there can be a major change in behavior because of the panic episodes. Now, if this lasts for say about a month or more, change in behavior is what I say. You were traveling by train and that train happened to have a derailment. You're so afraid of traveling on train that you say, I'll never travel on the train again. You were driving a car and there was a near accident. You nearly missed a major episode. You lose confidence in driving your car. So if things like this persist for more than a month after a panic episode, you would consider and label it as a panic disorder. Help from a mental health specialist is certainly quite important in such cases. The second anxiety state is generalized anxiety disorder. Now, panic attacks are usually sporadic. Now, it so happens that a particular event may have triggered anxiety for you, may have triggered panic for you. But before this, there would have been an established pattern of excessive worry about family, about money, about friends, about reputation, about colleagues, about jobs. So somebody who has had a constant level of excessive worry, and then there is a superimposed acute event that triggers a panic episode. So that you would say is very episodic. But in generalized anxiety disorder, there is an exaggerated worry consistently, which is not really linked to reality, which is persisting no matter what other people do or no matter what is the outcome of trying to reduce your worry. People who have generalized anxiety disorders, they live in constant fear of impending doom. Okay, so today it's COVID. I'm sure COVID is going to wipe out half our population. There is a war between Ukraine and Russia, and I'm sure that's going to go to World War III and thereby A, B, C, D, E. The stock market has crashed today. Most of my money now has lost its value. I will always be struggling for money. I don't have anything more. I'm closer to retirement. So there can be any external trigger. And the result is, living in constant fear, morbid thoughts that everything is going to go wrong. Nothing is going to work well for me. And that is again a part of it. Husband and wife have fought with each other. And one of them begins to think, oh, he or she is never going to love me again. He or she, I think, does not find satisfaction in living with me. And that constant fear, that would be generalized anxiety disorder. Now, with generalized anxiety disorder, you can have occasional panic episodes which are way off the charts. So you can have a general level of anxiety at all times, which results in periodic peaks of panic attacks. So both can exist altogether. Generalized anxiety disorder, in addition to panic attacks, has got some other physical symptoms. For example, headaches. It's a very common thing. Headache, which is because of the tension in your muscles at the back of the neck. It could be any part of your head. It's the back. It's common. Tremors. While doing certain things, there could be mild tremors. And you are unable to function fully, like, for example, putting in your signature. When you are in a stage of generalized anxiety disorder, your signature 10 times is going to be different. You won't be able to do the same things. Then there is sweating, increased flushing of face. Then typical is, people say is butterfly in the stomach. So that is the result of generalized anxiety disorder, if it's a very common feeling. Indigestion is another thing. So any of the physical manifestations that are not related to a known medical cause, and that makes you afraid of various situations or things, it would be generalized anxiety disorder. Just like there's a specific diagnostic criteria for panic episodes or panic disorders, generalized anxiety disorder also, there is a very specific criteria for its diagnosis. You should have first, know that there are 4 major categories of symptoms. The first is your nervous symptoms. Nervous symptoms would be, muscle pain, tiredness, restlessness. You can't sit comfortably. You are very fidgety. Your eyebrows are constantly twitching. Your eyelids are constantly twitching. You are frowning most of the time. So these are all the symptoms of nervous tension. So that's one category of symptoms that exist. The second is general symptoms, physical symptoms like palpitations, increased heart rate like tachycardia, sweating, tinglings in your hands and feet. You want to go to the bathroom more frequently. There is chronic indigestion, or you have diarrhea. When you try to speak something, there's a lump in your throat, your butterflies in your stomach. So these are all what we know as general symptoms. A little less common is what is known as apprehensive expectations. What does that mean? That means you're constantly worrying, constant fear, constant anxiety. You feel that, maybe what I am worrying about is not what others worry about. And yet you cannot stop yourself from worrying. And the last is the way your attention to what you have to do changes. You have short attention span, you get distracted easily, you are irritated quite easily, or you remain irritable, you become impatient because you want something to happen immediately, or you may be just fidgety. You would see people who are sitting, they constantly keep moving their legs, they keep moving their hands, they have to pick something, drop something. So if you have symptoms in all these four categories, which is your nervous tension, which are your general physical symptoms, which is your apprehension about something going wrong, and you have problem paying attention to various activities, one in each of these categories. And then at least for a month, you have had an anxious mood on majority of the days. And there is no associated mental illness. And if you're above 18 years of age, then we would call it as generalized anxiety disorder. This diagnosis is not made in people below 18 years of age. The third anxiety state is obsessive compulsive disorder. And very often now it's become kind of a normal conversation to tell, oh, he has OCD or she has OCD. Just ignore her. That's what she or he is, and ignore that, So that OCD, which is the acronym for obsessive compulsive disorder, quite often is misunderstood, and it is not identified as a condition that can benefit immensely from health, therapy and health. So obsessive compulsive disorder is usually chronic. It lasts for a very, very long time. You cannot wish it away. You cannot say, kal meri shaadi ho jayegi and I'm going to be fine. You cannot say, I get a better job and then this is going to be fine. You cannot say that, well, once I achieve this milestone in my life, I'm not going to have this problem. You cannot wish it away easily. Then you have uncontrollable recurrent thoughts, and can be associated with recurrent behaviors also. You want to keep repeating your actions, which are preceded by your thoughts again and again and again. So in obsessive compulsive disorder, you can have obsessions and you can have compulsive behaviors also. So say examples, very common examples of obsessions, very afraid of germs or contamination. COVID time, almost everyone has been very afraid of contamination. So you use your sanitizers extensively. I think people have gone past that stage now. But even without that, you're not happy with the maid who has cleaned your utensils or cleaned your kitchen, and you go and do it all over again. You come from outside and you feel your car key is contaminated or your lunch box is contaminated, and you have to keep it in a specific spot in the house every single day. Otherwise, the rest of the house gets contaminated. Then there can be unwanted thoughts about what you consider as taboo topics. It could be where you want to harm somebody. or certain religious fanatic thoughts, or taboo topics like talking about certain sexual behaviors. You cannot stop these thoughts from coming into you again and again. There can be a lot of aggressive thoughts. You may want to be aggressive towards others or to yourself, and you cannot stop those thoughts. And a very common, which is not always OCD, is when you want things in perfect order. Your books in your library have to be put in a particular way. Somebody else takes out a book and doesn't put it back, you get upset. Your cupboard, your clothes have to be in perfect alignment. In the kitchen, you organize your groceries. If anything is moved a little bit, you get annoyed. Now, if this begins to interfere with your relationships, with your ability to function on a day-to-day basis, we would consider as abnormal. But just wanting to be neat, well organized, others may label it as OCD, but that's not necessarily OCD. Okay. What are the compulsive behaviors? Very often they're related to all of the thoughts, compulsive thoughts that you have. But the important thing to remember is that there is no control on these behaviors, which means if you want to clean your kitchen after the maid has gone, but there are other things that are more important to attend to, you will not attend to important things because you're obsessed about cleanliness in your kitchen. These thoughts should last for at least 1 hour every single day, 7 days a week for minimum 1 hour. These thoughts, these behaviors and these thoughts should last for you. And when you do the behaviors linked to your obsessive thoughts, there's no joy in it. That means there's no sense of satisfaction. You feel that, oh, all my clothes from the office are full of germs. I have elderly parents at home. The moment I come, I go have a shower and I come back. But when you do that with the fear, with an anxiety that I'm going to give germs to my parents, there is absolutely no joy. You may go repeatedly to see, did I put my clothes in the laundry basket? Did I put it with the other clothes that my family members are going to wear? Did I segregate it properly? Did I immediately put it in Dettol water? Now, these are the behaviors that you have no control over. And once you do them, there may be a very brief respite from anxiety, but you don't feel happy. You don't feel a sense of achievement that I have done something that was desirable to do. And relationships and your routine activities definitely get affected if you have obsessive compulsive disorder. So how do you manage anxiety states? Or you want to help somebody manage it? First and foremost, I think if you are going through it, it's important to say it's something that a lot of people go through. It's not minority of the people. It has nothing to do with quote unquote mental weakness. People say, if you're strong mentally, if you have a strong willpower, if you really want to do something, you can do it. And if you cannot do it because of anxiety, then automatically you may think I'm being labeled as somebody who is not good enough, who is weak-minded, who doesn't have enough willpower. Please banish all these thoughts. It's something that you can help. If you don't have anxiety, but you're seeing somebody else go through anxiety, and if you try to reassure them saying that, don't worry, it'll go away. You stop worrying and everything would be fine. Easier said than done. I don't think the person is going to have confidence in your ability to support him or her through those anxiety states. Instead, if you were to say, I understand you're feeling anxious. I understand that you are very concerned and worried about it, and it's affecting your day-to-day life. But let's work together and see how we can reduce it. So even one statement saying that I understand what you are going through, demonstrating your understanding, that's your empathy, and then supporting them will have a greater impact than saying things like you're ruining your life, you're doing unnecessary things, like basically different forms of labeling. So the first thing that would come in the priority of managing your anxiety states would be psychotherapy. I would strongly recommend a trained psychologist, because they have gone through enough training to understand how to manage these. If the anxiety is very debilitating and it is not allowing you to function even 50% of the time, a clinical psychologist would be preferable because they have had a slightly more specialized training than a general psychologist. But trying with any psychologist. Now, here I would like to say one thing. The relationship between a client and a psychologist is a very personal relationship. Your friend tells you, I went to so and so and I've benefited a lot. I like that person a lot. You must go there. Doesn't mean that you also relate to the person in the same way. So for some reason, if you didn't feel understanding or you didn't feel that you have adequate support from a psychologist or a therapist, go and find somebody else. You may have to go through one or two people till you find somebody who really clicks with you. So do not get disheartened if one experience or one or two sessions are not enough. Plus, it may take several sessions before the counselor even understands what you want or what you are going through, or even for you to define your own goal of counseling, your own goal of psychotherapy. It may take time. So give it time and patience. It's not something that can get through with just 2-3 sessions. It can take a much, much longer time. When you begin psychotherapy, there are two definite things that are done. One is known as insight psychotherapy and another is supportive psychotherapy. Now, those who are counselors here would definitely know more about it than what I would know. So in the insight psychotherapy, which would be the initial part of it, they would find out first all the factors that are affecting your relationship with yourself, with your friends, with your family, at workplace, all over your relationships. How is that affecting you? Number two, do you have motivation for sustained partnership with the psychotherapist to change, to overcome what you are going through? And the third is, how equipped are you to deal with difficult situations in life? Different people have different thresholds of dealing with difficult situations in life. Based on the outcome of these three is how the supportive therapy is going to be influenced largely. So supportive therapy, you will constantly discuss your issues bothering you with your therapist, with the doctor, but that would be, the discussion would be greatly based on the outcome of your insight therapy, that initial period the counselor or the doctor would have gone through. Because two people experiencing the same situation may react totally differently. 5 students in a school going through intense bullying, all 5 may react differently. And thereby the approach to support also is going to be different. So do not compare your notes of what the counselor or the therapist is telling you with anybody else going through similar situations and feel miserable, because your journey is your independent journey and the support you require would be very, very specific to that. Now, the last portion that I would suggest in this is medication. Short-term medication for anxiety disorders are prescribed. Now, it may be the same medicines as they prescribe for clinical depression, but they would be much, much milder in doses than otherwise. But if it is severe anxiety disorder, then the dose of your medication would be higher than your dose for, say, depression. The benefit you start seeing is after several weeks, and the maximum benefit you would see is 10 to 12 weeks later. So do not equate, if you have been prescribed medicines for anxiety disorders, do not equate your response to Crocin tablet. I took Crocin, within 1 hour, my fever came down. I have taken medicines for 2 days and I still have my obsessive compulsive disorder thoughts. I have compulsive behaviors. Give it 10 to 12 weeks. The doctor would know how best you could be helped. Now, that short period of time when medications have been prescribed to you and you have been going through your regular therapy, your sessions with a counselor, you must try various relaxation techniques. That's something your counselor will definitely teach you. You could adapt it on your own. There are plenty of things that are available now in the digital world. Same is true for meditation. Meditation is best when you have done it with a person who is trained to help people learn meditation. Meditation is not what I recommend you learn from YouTube and do it. And there are different approaches to meditation. I'm not going to go through all of that again. And whichever appeals to you, whichever you feel is helping you, is what you must do on a sustained basis. So if you have a long-term support for cognitive behavior therapy from your therapist, if you have taken the medications for a short period, could be just a couple of months, 3-4 months, or whatever duration the doctor thinks is necessary, and while on medication you have started relaxation techniques and you have practiced meditation, your anxiety states can be history. But once you have reached the stage of calm and comfort that you wanted to reach, do not give up on your relaxation techniques and your meditation. That should become a part of you, as important as brushing your teeth every day. The moment you give it up, you don't know what is awaiting you in the next corner of your life. And your panic attacks can come back. Your anxiety disorders can come back, because now newer episodes have come. Even if you have worked a lot on various psychological tools like inner child therapies, you have gone through addressing your childhood traumas, and you have done a whole range of techniques that are available now. But the impressions of what you have gone through will remain. At a conscious level, you have addressed that. You have said, that's my past. I don't have to repeat it again. As a child, I handled bullying badly, but I am an adult now, and I know how to handle bullying in my workplace better than what I did as a child in my school. Despite that, the impressions can trigger further episodes of anxiety, yes, anxiety attacks. So do not give up your meditation and your relaxation techniques, come what may. So medicines, if prescribed, not everybody will require meditations. OCD, certainly medication is required. But for other things, like generalized anxiety disorder or for panic disorder, a short-term medication may be prescribed based on the intensity of your symptoms. The psychotherapy with a counselor, your relation should be for a much longer duration, few months, a year, for some people even little longer than that. But your relaxation therapy, relaxation techniques and meditation should continue for life. Are there any questions till now?
Yeah, there are a few questions. There's
okay.
So Isha Prakash has asked how to help with intrusive thoughts that we are unable to get rid of.
Okay, so intrusive thoughts is also, of course, very much closely linked to anxiety. I mean, the person, as Prakash has identified and is asking this question. By wishing the thoughts away, they are not going to go away. So the first is you acknowledge and you say that these are the thoughts that I do not want in my life. Second is, do take help from a clinical psychologist. Mm-hmm. Follow their advice very clearly. Now, if there are feelings, the repeated thoughts or intrusive thoughts are related to an impending doom, for example. So what typically they would do is try and simulate, either through conversations or through images, of various techniques are there, starting with the least stressful situation. If there are like 10 situations that cause you these kind of intrusive thoughts, then the least intrusive situation they start with, help you deal with it, move on to the next with little more intensity. But if your intrusive thoughts are repeatedly, say, related to it's say sexual relationships, it could be, say, about religion, it could be about the harm that is being caused to somebody, then cognitive behavior therapy is absolutely essential. Find a therapist who is trained in cognitive behavior therapy and who has shown results in cognitive behavior therapy. Again, if there are repeated intrusive thoughts, which are extremely severe, and CBT is not helping you, you may have to consult with a psychiatrist and take a short duration of medicines. So again, it depends on how intrusive these thoughts are. So if you are sleeping for 8 hours a day, in the remaining 16 hours, how many hours are these thoughts repeatedly coming? If there's a deadline at workplace, are you able to put a hold on your thoughts and deliver the deadline? If there is no deadline, then you may go on procrastinating on delivering whatever you have to, because the thoughts are very intrusive.
Mhm.
Then cognitive behavior therapy can help. But you need to commit to a therapy. Without that, it cannot be helped. You cannot wish them away. Do not say that I'll have the willpower and it'll go away.
Okay.
Okay. Does this answer Prakash's question? Can he say yes or no?
I think we can unmute Anshu. I think we can unmute the participants and maybe they can ask a few questions.
Yeah, before I go to phobic disorders, I want to close this part of it.
Isha Prakash, can you reply? Did you get your answer for the question, Isha? Okay, we didn't get an answer. So I
So
think
we take it as yes.
yes, we take it as an yes.
Okay, so I go to the next part of the anxiety states, which is phobic disorders. Now, phobias, we normally say, oh, well, I have a phobia of this, I have phobia of dogs, or phobia of cats, or, it's a term that we use very loosely. Quite often, any irrational thought, fear of a specific situation or activity is common. But again, when it begins to affect your day-to-day living is when we would consider it as a disorder. You are scared of skydiving. It's okay if you never do skydiving in your life. It's not going to affect your life. Your fear of heights. It's okay if you never climb a mountain. That's okay. You can still manage your day-to-day life. But anything that is, that is affecting your day-to-day living, which is what we'll call as phobic disorders. In phobic disorders, there's a strong urge to avoid. I don't know how many of you have seen, in malls and others were introduced in the initial stages, you would see a lot of people afraid to get onto the elevator, because now it's becoming more common. But whether it's a child or a middle-aged person or a young adult or an elderly person, but they would be so afraid of the moving staircase that they would not step onto it, right? So they would much rather climb stairs. If people are afraid of lifts, and despite lifts being in operation for how many decades in our world, there are many people who still are very afraid of lifts and they would not use them. So there are three main features for phobic disorders. The first is that the fear is disproportionate to the circumstances. Typical example is an elevator or an escalator. Then you are unable to deal with the fear by reasoning either yourself or somebody else reasoning with you. Whatever explanation somebody gives, the fear does not go away. And the best part is, you know that your fear is irrational and yet you cannot deal with it. That means you see there are 20 people who are going in the elevator in front of you, and you see people every single day using elevator in your apartment, but you will still not use them because you are afraid of them. So there are three common types of phobias we talk about. It's called simple phobia, another is called social phobia, and the third is called agoraphobia. Simple phobia is the commonest, where you're afraid of certain objects. It could be any object and you're just afraid of it and you would not want to deal with it. You're scared of it, you don't like it, there is something that results in a restlessness in you, you won't do it. Social phobia is where you're afraid of crowds, you're afraid of being in large gatherings, in various functions. And agoraphobia is where you are scared of certain situations, like say being trapped in an elevator, in a tunnel, or from where you think there is no escape for me. So these are the main kinds of phobias that you would normally come across. How do you deal with them? Let's first think of social phobia. Social phobia, not social phobia, simple phobia, usually happens very early in the development stage of a child. A child, bitten by a dog at a young age, for all you know, is scared of dogs all his life, even when he grows up. Somebody, went swimming and suddenly went underwater and swallowed a lot of water, had a panic, may be afraid of swimming or water or oceans for the longest of time. So usually in the development stage of a child's life, is the experiences that happen is what results in a simple phobia. It can recur after a long period of time. For example, if you're living in the middle of, say, you're living in Madhya Pradesh, you never have exposure to an ocean, and you had some experience in your childhood with water, and you've never even thought about your fear of water, but suddenly you go on a picnic or on an office tour or somewhere, and you don't want to step into the ocean. Your entire fears come, your panic attack comes, you're very afraid of water. So it can come after a period of having no symptoms at all. And if it is affecting your day-to-day life, occasionally it happens, it's fine. If it is affecting your day-to-day life, as a golden rule that I'm repeating again and again, you must seek help for it. Now, if you're exposed to any object that you have a phobia for, panic episodes can also be triggered in. It could be an isolated panic attacks, or it can happen repeatedly. It does not matter. To call it a disorder where you have to take help, it should last for more than 6 months. And those 6 months, your day-to-day life or day-to-day activities that you're supposed to do is adversely getting affected. And of course, there should be no associated mental illness with it. So that's a constant with every anxiety state. What is a social phobia? Social phobia is a little more common than we give importance to. It is the fear of behaving in such a way that we feel others will ridicule us or others would look down upon us. And that's a constant fear, and you avoid those situations. You are afraid of being in a situation where people you think are going to scrutinize you. So you're afraid of scrutiny. You are very scared, you're very anxious about anxiety, about being critiqued, or when somebody, you think is going to ridicule you. So you're constantly feeling somebody is going to look at me and think ill of me, or they're going to make fun of me, or they're going to look down upon me. And you try to avoid these. All of this stems from one factor, that you are very afraid of what you define as shameful behaviors. And then you try to avoid them. Now, any situation where you think people are going to inspect me, not just the way I'm dressed, but the way I speak, the way I behave, and the way I do a particular activity, you can have an intense reaction. And that would be called a social, it could be a social phobia. Sometimes if you're forced to behave, like for example, you are forced to demonstrate a skill that you're supposed to do in your day-to-day work, you may not do the same action as well as what you normally do because of your social phobia. And sometimes it can be associated with a generalized anxiety state also, because you're so afraid of being ridiculed, being scrutinized, being criticized, that there is a level of anxiety that is persisting as a baseline at all the times. The last of the phobic disorders is the agoraphobia. This is like afraid of being alone in public places without any known person, or in any place from where you feel that your escape is not easy. I give you the example of crowds, tunnels, being on top of a bridge, or a public transport like a train or a metro train, that you cannot get out in the middle of something. And you want to avoid these situations under all circumstances. People who live in cities where metro trains have been introduced might know that there are a lot of people who would much rather take a bus than take a metro train. They would much rather walk than take a metro train because they feel that it's going to, even if it's not going to go underground, but you cannot stop a metro train in between and they cannot walk back on the tracks. So they're very afraid of it. And this fear goes on increasing where gradually there is a restriction to your normal day-to-day activities and you're not able to function as well as you ought to function in life. Now, some medicines can give you this kind of restlessness where you are afraid of spaces or some amount of anxiety. So if you have not taken those medicines, there is no other mental illness, and your day-to-day life is being affected because you're afraid of being in situations from where you think no help would be given to me. A lot of people don't want to stay alone at home. What if I have a heart attack and I can't reach the hospital immediately? And they would insist somebody stay with them. And this you see as people are growing older much more often than at any other time. Agoraphobia is at the moment considered to be about 10 times more common in women than in men. I don't think it is linked to anything to do with the woman's body or her hormones. I think it's a lot to do with the social upbringing of the women. Women have been brought up where men have to protect them. They cannot take independent decisions. They have to do more work in the house. They cannot go out and function independently. Now, all these gender norms which existed a few decades ago are now being wiped out. Yet, majority of the women still have not come on par with the gender roles that were assigned for men. So we still see that this is more common in women. Now, sometimes there is also a fear of being in difficult situations. So one is, I don't want to go to a place where my train has to go through a tunnel. Another is I'm afraid of the fear of going through the tunnel. And thereby, again, you would avoid going into it. So fear of fear itself can be actually a vicious cycle. And that makes it difficult for a person to try and address it or want to even take help for it. So how do we diagnose? There is a rational fear of your surroundings or any of the situation that's considered normal around you. You have symptoms of anxiety because of the situations or because of the possibility that you may be in those situations, and you do everything in your power not to stay in closed spaces or crowded places. So that's what would be agoraphobia. How do you manage agoraphobia? Again, for that, are there any questions coming in? No. Okay. So
Savitri, yeah,
yes.
we can quickly have two questions.
Okay.
So one question is, if you have to seek help, should we go first to a psychiatrist who would then refer medication, or a psychologist, or first we go to a psychologist directly?
Okay, so if your symptoms are only related to anxiety and there is nothing else, how do I say nothing else? Clinical depression. You don't take joy in normal activities that you do. You want to do some things, but you are unable to do. You are not very functional. You are sad quite a lot of times. Go to a psychiatrist. You hear some voices. You see things that other people don't see. Go to a psychiatrist first. But if you don't have these kind of symptoms, then, and you're not going through extremes of moods where at one level you are so confident that I could just be a bird and fly off a window, and at other times you're so dysfunctional that I don't think I can achieve anything in life. If you don't have these kind of symptoms, please consult with a psychologist, because psychologist would be the best person to help you with anxiety. And if after a certain period of either assessment or certain period of helping you with a behavior therapy, you are still not responding well, the psychologist may ask you for a short-term treatment, then you go to a psychiatrist, but not otherwise. So again, to repeat, if you have symptoms like depression, you have symptoms where you're hearing voices or any of the psychosis or extreme mood swings or inability to control your anger, those kind of situations, please go to a psychiatrist first. If none of those exist, you go to a psychologist first. Okay, what's the next question?
Uh, a few ways that we can manage social anxiety, and do these anxieties as an adult trail back to the childhood traumas?
Okay, quite often there is a trail back to a childhood trauma. That is very, very much existent. And how do you deal with it? One is, of course, you go to a professional and a psychiatrist, a psychologist is able to help you with it. Another way is to try and gradually increase the level of intensity of your fears. For example, if you're afraid of a large crowd, get comfortable in a group of about, say, 5, 10, 8 people, but don't go alone. Go with somebody else who you think is going to protect you and support you in case you have an anxiety episode then. Gradually go on increasing the intensity of being in those kind of social situations. Okay, that is one part of it, which is extremely important. Another part of it would be basically self-love. It's easy to say, I should love myself as I am, but not always easy to do, especially if you're very scared of somebody's scrutiny and somebody is feedback and you're constantly anxious about it. I think you must take help from people whom you trust, not necessarily a psychologist, but somebody who you trust and who you think is interested in your welfare. Constantly take their help to value yourself, to try and understand what are your situations and to love you for what you are. So once you do that, then your social phobia can come down to a large extent. The third situation is, in your own mind, you can write it, you can practice it, practice what's known as what if. So what if means, okay, what if somebody tells me that I didn't speak well? What does that matter? How does that affect my day-to-day life? Will my spouse stop loving me? Will my children stop loving me? Will my parents stop loving me? Will that mean that my job is taken away from me? Okay, even if my job is taken away, or even if I don't get a promotion, is that the end of the world? Can I find another job? So the what if at every stage can help a lot if it is not very severe social phobia. The other is something known as 5 whys. 5 whys, I'm sure, in a lot of corporate people who are present here today, you would know what is 5 whys. 5 whys, you ask, why am I afraid? You get an answer. Then ask, why is this happening? Questioning yourself on those whys till you find out the root cause of your fears. Then find ways to address it. So if you are not able to immediately go to a therapist, social phobia you can handle with your loved ones, somebody who you trust, and gradually increase the intensity of your exposure to the intensity of discomfort. Like I said, start with 5, 6, 8 people, then be in larger crowds of 10, slightly larger groups. If you're very afraid of going, say, for formal parties, then don't go immediately. Increase it, with more and more of unknown people, strangers, and you could probably help yourself. Does that answer the question?
Yes, this question was by Shruti Pradhan. I hope it is answered. Shruti, you can put in the chat box. And Savitri Isha did say thank you to you. It was in the chat box. Yeah. And the intrusive thoughts, the question that she asked was, she said that it was mostly around COVID and social anxiety.
Okay, so COVID and social anxiety is a very real anxiety. Okay, like I have been also very afraid of going out and mingling with people because I wanted to protect myself. So that is a very real thing. But if it is adversely affecting your day-to-day work, then you have to treat it as anxiety. Now, if you've gone through COVID per se, and you have had bad COVID, or somebody very close to you has had bad COVID, we would call it as post-traumatic stress disorder. And that's a different kind of management altogether. So a specific event of trauma that has caused anxiety would be treated very differently from what is, an unknown, irrational anxiety, fear, restlessness, or a phobia.
We have another question here
Yes.
from Channa Virappa. I feel anxious while going to rest. If I'm busy with work, I feel relaxed. Sleeping time is reduced to 3 to 4 hours. There's a pain in an abdomen and severe acidity problem. How can I overcome these?
Okay, so unless we know what is the reason, why is the person wanting to be busy all the time? Is it because you want a validation that you are worthy of something in life, and that you can be only when you are producing something? Are you afraid of the thoughts that cross your mind when you are relaxing? Are you so particular about your achievements that you feel that when I sleep, it's a waste of time? So we need to first identify why you are afraid of sleep and address the exact cause for it. The most important thing is to tell yourself, if I don't sleep enough, my anxiety is going to worsen, physical illness, I'm inviting lifestyle diseases big time. I mean, even as older people, we know that growth hormones come in when we are sleeping, and we all need growth hormones. It's not just the babies who need it. So sleep is very, very vital. And for that, one definite immediate solution I would like to give is the relaxation techniques at bedtime. There are plenty of YouTube videos available. Try out different videos and see what helps you most. Try them out, and each of them you must give it a trial for at least 3 weeks. It takes about 3 weeks for you to adapt a new behavior, get out of an older mold and adapt a new behavior. Like suppose you want to give up coffee, it'll take you at least 3 weeks or before you start feeling comfortable to a life without coffee. So any meditation technique you try, please give it a trial for 3 weeks.
Yeah.
But this has to stop. You cannot sleep for 3-4 hours a day and then have indigestion, very common with anxiety. So while working, you are just distracting your thoughts. You are putting a temporary cover to what is an underlying restlessness. Look back at your childhood. And if there is a childhood cause, then a psychologist who can do inner child work is absolutely important. Somebody who deals with just adults' issue will not be enough.
Thank
Okay.
you.
Any other questions?
I
One
think
is
that's well answered by Dr. Savitri. Channa Virappa, I hope you got your answers. Any other questions?
one question comes from Isha Prakash.
Okay.
How do we
Yes.
differentiate between social phobia and social anxiety?
Okay. So social phobia is the fear of being in situations where people are scrutinizing you, and you try to avoid going through those situations. And gradually you're isolating yourself more and more. But social phobia can also be associated with social anxiety. That means when you are forced to be in situations where you think people are going to judge me or scrutinize me or critique me, you have your panic attacks. But suppose it is just the restlessness that you feel in a crowded situation without the fear, without a desire to avoid those situations, then we would just call it a social anxiety. Phobia is definitely a fear, and fear intense enough for you to avoid those situations. But social phobia is very often associated with social anxiety.
Right. Very much clear. Thank you, Savitri.
Thank you.
There's another,
Any other questions?
yeah, there's another question here.
Mhm.
So, should one first go to a psychiatrist who then decides whether to give medicines to refer to a clinical
Yeah,
psychologist?
she answered that, Anu.
Oh, okay. Sorry. There's another question there too. Yeah. Okay, the other question was, is decision making fatigue making it difficult to make decision, also anxiety? I didn't understand. Is decision making fatigue
Hmm?
making it difficult to make a decision is also anxiety, like while deciding one feeling breathless or heavy? The question is not very clear. I think the person is asking whether that can be associated with anxiety.
Okay, so what I'm understanding is if a person is always in charge and everybody looks up to that person for taking decisions, there can be a certain level of fatigue for it because you don't get a respite from it. Everybody is looking up to you, and just the thought that you are responsible for so many people can cause quite a bit of mental fatigue. So if that is what the person means by decision making fatigue, and if that is resulting in physical symptoms of indigestions, or you have loose motions, you have more frequent desire to pass urine or go to the toilets, or there is certain level of anxiety, lack of confidence in oneself about able to take decisions, then it is certainly an anxiety that requires to be addressed. Again, let me repeat, if it is something that has lasted for 6 months and more, the fear of taking decisions, or the unhappiness of being in a situation where you are taking decisions all the time, then if it has lasted more than 6 months and it's also now gradually affecting the performance, then it requires care. And here I would recommend a counselor.
Okay. Okay, thank you for that.
Any other questions?
Um, no questions asked so far.
One more question regarding decision making. Indecisiveness and confusion hampers my life in a day-to-day basis. Is it a part of anxiety disorder?
Okay, so indecisiveness is not anxiety disorder. But if you are constantly afraid that I won't take a decision, or if I take a decision and that's a wrong decision, and that prevents you from functioning normally, that would be an anxiety disorder. But a lot of things, like the way you're brought up, suppose you were never encouraged as a child to take your own decisions. That somebody put as a mandate, you have to do this and you have to do this. A lot of schools also do that. So you may have never learned how to take decisions. That would not be anxiety disorder. But yes, you may still benefit from help from a counselor to help you to become self-reliant and confident to take decisions.
Okay.
Okay, any other questions?
No more. You can maybe we can move forward with the topic.
Okay, so as far as anxiety is concerned, both anxiety states and phobic disorders I have completed. And I hope that people would be able to identify what is in the normal realm of short-term duration that does not require care, and when they have to take professional help. If that distinction is clear, then I don't think I have anything more to add.
Yeah.
Is there anything else that you would like me to cover, Anupama
Um,
or Lena, anybody?
yeah, I think you answered a lot of questions, and OCD being very lightly spoken nowadays, it is not as lightly as it is. Everybody seems to be telling OCD after COVID. Yes, it is definitely, you answered a lot of doubts for us. It was very insightful, your the way you explained the different kind of phobias, the anxiety. You just simplified the whole thing. I think we got a lot of insight into it, and it's already 5:30. I think we've taken more than the time that we had asked you off. We want to thank you for your time. We really will look forward to another session where maybe we can have more constructive questions to come to you, because we understand you are your ocean of knowledge in these subjects. Thank you, Savitri, for coming to Pran and giving your time here. We really appreciate that. There is one question before we close down. The last question I think we will take for this session is, when someone has been toxic to us but tries to manipulate by taking a second guess, how can we overcome second guessing when a behavior was evidently negative? The question itself is quite pretty deep.
So what I understand is others have a toxic behavior towards you, and you have to second guess why the person is behaving like that. Is that what the question means?
Yes.
Okay, so see, one thing that please one has to understand is the difference between reaction and response. So if somebody is behaving toxic with you, it is that person, it just reflects on that person's personality, has nothing to do with you. Okay, so that's the first thing to tell yourself. Instead of reacting to it immediately, take a time, pause on it, remind yourself that that behavior in no way reflects on what you are as a person, and then respond appropriately. If it is something that's happening repeatedly because you cannot avoid that individual, the best is to take preventive measures. And preventive measures, would be as wide as the number of trees in this universe. It's like whether you avoid the person completely, whether you take initiative in such a way that you take the lead in the relationship and the other person is thereby made a bit redundant, or if it is an office situation where if you think you can address it to somebody senior to you, if it is your own spouse or it is a very close family member, can you go either as an individual therapy or a joint therapy? The situation will demand that. But yes, that would not be in the realm of anxiety disorder unless your fear of somebody's toxic behavior is so intense that you're not able to function in that situation. And if that dysfunction lasts for more than 3 weeks, that anxiety lasts for more than 3 weeks, then I would say that you take help. Otherwise, you find your own ways. Don't react, just respond.
Okay.
Does this answer the question?
Yes, it does, Dr. Savitri. Thank you. Thank you so much for your patience and answering each and every question. Thank you so much. We just want to take this opportunity from Pran to thank you for.
Most welcome.
And we look forward to many more seminars and collaborations and interactions with you. Thank you, and thank you all.
Thank you all for being here.
Yes.
And of course, Pran, for having me.
Yeah, thank you. Thank you so much.
Thank you, Savitri.
Thank you. And I just say a happy life to everybody. Happier, anxiety-free. There were a few who said 1 and 2. And for those who said 1, I hope this is the moment from where you take control of your own life and that 1 should become 0 soon.
That is such a positive words that you shared just now, Savitri. We thank you for those positive words. I hope everyone who are here, the participants, would are definitely, empowered with all the words that you have used. And yes, thank you. Thank you so much, Savitri.
Thank you. Okay, bye.
Bye-bye.
Bye-bye.